Welcome to today's deep dive. We are we're pulling from a really fascinating and honestly just deeply moving stack of sources today.
Yeah, it's a really powerful collection of material.
It really is. We're looking at family testimonials,
Yeah.
program brochures, state survey results, and even some care technology data. And it's all centered around one specific case study, which is Shadow Mountain Memory Care in Phoenix, Arizona.
Right. And our mission for this deep dive is really to explore what looks like a truly transformative approach to dementia care.
Exactly. We want to unpack why we keep seeing this one incredibly consistent, honestly kind of surprising theme across all this feedback.
It's the one thing that stood out immediately.
Yeah, because families who finally make that agonizing decision to move their loved one into this community, they almost universally say the exact same thing. They say, we wish we'd found this place sooner.
Which is, that's a profound statement, right? It fundamentally challenges how we typically view elder care. So this deep dive is going to look past that outdated idea of memory care as just, a secure facility with locked doors. We're going to examine how this genuinely innovative model actively engages its residents, uses cutting-edge safety tech, and crucially, how it supports the entire family ecosystem.
Right, to the point where they actually feel that immense relief.
Exactly.
So to give you a sense of why this mission matters so much, I want you to imagine just for a second a reality where you are on the clock 24 hours a day, 7 days a week.
Yeah, literally 24/7.
And your job isn't filing reports or, writing code. Your job is keeping the person you love most in the world safe from themselves every single minute of the day.
And you don't get weekends off.
No weekends.
Yeah.
You don't get to clock out at 5. You barely get to sleep. You are just living in this constant state of hypervigilance.
It is a level of exhaustion that is honestly almost impossible to fully comprehend unless you've actually lived it. It goes so far beyond just physical fatigue. It's this relentless, compounding emotional drain that just fundamentally alters the whole dynamic of a household.
And that is the reality for millions of people navigating the journey of caring for a loved one with Alzheimer's or dementia.
Absolutely.
The emotional reality of making the choice to actually seek professional help is incredibly heavy. And the sources we're analyzing today, they don't shy away from that weight.
No, they really dig into it.
We have access to this data from a platform called GoIcon, which is what Shadow Mountain uses to collect family satisfaction surveys.
Right?
And they have this staggering track record. 20 consecutive, perfect 10 out of 10 ratings.
Which is just wild in this industry.
It is. And when you read the qualitative feedback, the quotes are filled with phrases praising the compassionate care and emphasizing that their loved ones are, above all, healthy and safe.
But, a perfect score is just a number.
Right. Exactly.
To understand what that 10 out of 10 actually means in practice, we have to look at the story of a real caregiver from our sources.
Yeah, and the case study of Pat Demarest is particularly striking here.
It really is. Her experience grounds all of this survey data in a very raw, very human reality.
So Pat's husband was diagnosed with Alzheimer's, and a really crucial detail in her story is that he was about 10 years younger than the typical memory care resident.
Which completely changes the dynamic.
It really does. Because of that age difference, Pat was fiercely determined to care for him at home.
Right.
In her own words, she noted that taking care of his physical needs was, well within her skill set. But the nature of the disease just made it relentless.
Yeah.
She describes struggling intensely with what she calls the two big G's, guilt and grief.
Man, those two emotions are really the twin pillars of the caregiver's dilemma.
Yeah.
The grief is for this ambiguous loss of the partner she knew, who is slowly fading away, even though, he's still physically right there in the room.
Right. That ambiguous loss is so hard.
It is. And then the guilt stems from this societal pressure we all internalize. This idea that placing a spouse in a care facility is somehow abandoning them or, failing in our marital vows.
She actually said she spent an entire summer just weeping.
Oh, wow.
Yeah. She felt selfish for even considering a memory care community, despite the fact that her own health was visibly deteriorating.
Because of the stress.
Exactly. It actually took an intervention from her own children.
Really?
Yeah, they tried covering for her for just one single weekend. And the sheer demand of that 48 hours made them realize just how unsustainable the situation was.
I bet.
So they sat her down and they told her, Mom, it's time to place Dad. You don't have many good years left. You need to live your life.
When you're providing round-the-clock care like that, your entire relationship dynamic undergoes this forced mutation.
What do you mean?
Well, you're no longer acting as a spouse, sharing equal partnership and emotional intimacy. You are functioning as a full-time nurse, a security guard, and basically a project manager. So Pat's story really highlights the profound shift that happens when a family finally finds the right community.
Yes.
Placing her husband at Shadow Mountain allowed Pat to transition her role. She was able to put down the clipboard and the medication schedule and literally return to being a wife.
Okay, I have to push back on this a little bit, though,
Sure.
because it completely makes sense that taking away the physical burden, the bathing, the constant monitoring, the managing of daily pills, that obviously provides a massive wave of relief.
Absolutely.
But how does a facility, no matter how highly rated or compassionate the staff is, actually replace the emotional connection and that unique intimacy that a spouse provides in their own home?
That is such a good question, and honestly, that perceived paradox is one of the most common hurdles families face.
It makes sense why they'd worry about that.
Yeah. But the reality is that the facility is not there to replace the family's emotional connection.
Okay.
The facility exists to free the family so they can actually experience that connection again.
Oh, interesting.
Think about the alternative. When you are chronically sleep deprived, terrified that your partner might wander out the front door, and constantly forcing them to do things they might resist, like taking a shower, that friction just destroys intimacy.
Yeah, you're just managing crises all day.
Exactly. You can't just sit and hold hands and enjoy a shared moment. But because Shadow Mountain handles that relentless baseline daily care, Pat can now just go visit her husband and simply participate in the joy of the moment.
She doesn't have to be the bad guy.
Right. She doesn't have to be the enforcer. She gets to just be his partner again.
Which brings us to what actually happens inside the walls of this community to facilitate those joyful moments.
Yeah, the actual day-to-day.
Because Pat's husband, being younger and mostly surrounded by older women in typical care scenarios, he needed a very different kind of environment.
Right, he needed stimulation.
Exactly. He didn't just need to be kept safe. He needed active, engaging challenges. And the sources detail that at Shadow Mountain, they're doing things like playing cornhole and volleyball, hosting trivia and Jeopardy games.
Not your typical bingo night.
Not at all. They even have live musicians performing 3 to 5 times a week.
That's incredible.
And Pat noted something amazing. Her husband, a man who had never danced a day in his life, is now out there dancing and singing along with the bands.
See, that transformation speaks directly to their core operational philosophy.
The Luminate program.
Yes, Shadow Mountain utilizes this evidence-based approach called the Luminate Memory Care Program.
Okay.
It's designed around the concept of holistic sensory engagement. The philosophy acknowledges that cognitive decline limits certain types of interaction, sure, but sensory pathways often remain robust much, much longer.
So it's about reaching them through the senses.
Exactly. You don't just passively manage someone's physical decline, you actively stimulate their memory and emotion by engaging all 5 senses.
The examples of this Luminate program in our documentation are just so vivid.
They're great.
Instead of just, putting a television on in a common room, they are actively baking fresh bread in the community.
I love that one.
Right. And the specific purpose is to fill the halls with that comforting aroma, because the smell of fresh baking evokes deep-seated, warm, nostalgic memories for almost everyone.
Such a powerful trigger.
They also make these brain-healthy smoothies, which is a really clever way to ensure residents are getting proper hydration and nutrition.
But without making it feel like a medical thing.
Exactly. It's framed as a shared, joyful social experience rather than a clinical dietary requirement, and they heavily utilize targeted aromatherapy.
Yes, the aromatherapy protocol is a brilliant application of neurology.
How so?
Well, the olfactory nerve has a direct, hardwired link to the emotional centers of the brain, the amygdala and the hippocampus.
Okay.
So Shadow Mountain uses invigorating scents like citrus in the mornings. This provides a subconscious sensory cue to the brain that it's time to feel awake, refreshed, and engaged.
Well, that makes a lot of sense.
Right. And then they transition to calming scents like lavender in the evenings to help reduce sundowning anxiety and promote natural, healthy sleep routines.
So they're kind of working with the brain's natural rhythms.
They're effectively bypassing the damaged cognitive pathways and accessing the resident's emotional state directly through their senses.
That makes incredible sense.
Hmm.
But here is where the sources get into something that, honestly, it feels a little counterintuitive at first glance.
Okay, what's that?
Reading through Pat's account, she mentions that the residents are given Spanish lessons.
Yes.
Spanish lessons for dementia patients. If someone is struggling with severe short-term memory loss, what is the point of sitting them down to teach them a completely new language?
It seems like a waste of time, right?
Yeah, I mean, they likely aren't going to remember a single word the very next day.
If we evaluate learning purely through the lens of academic retention, then yeah, it seems totally pointless.
Right.
But we have to reframe what the activity is actually trying to achieve. The goal of the Spanish lesson is not long-term vocabulary retention or, passing a fluency test.
Okay, so what is it?
It's about cognitive stimulation in the immediate present. It is about providing the dignity of learning.
The dignity of learning. I like that phrase.
Yes. Treating adults like adults who still possess the capacity to engage with new concepts. As Pat noted in her story, even if her husband doesn't retain the words, the activity required them to sit together, to focus, to laugh at mispronunciations, and to really engage their minds.
She actually pointed out that she now knows her colors in Spanish because they participated in the class together.
Exactly. The intrinsic value is the experience of the connection itself. It keeps the neural pathways firing in the present moment, generating dopamine and a sense of accomplishment, regardless of what happens the next day.
It completely flips the script on how we view cognitive decline.
It really does.
It stops being about what is lost and starts focusing entirely on what can still be experienced right now.
Yes, exactly.
But as amazing as Spanish lessons, fresh baked bread, and 5 days a week live music sound, absolutely none of that matters if the foundational baseline of the community isn't built on ironclad safety.
Oh, absolutely.
You cannot enjoy dancing if you aren't physically secure.
That is the uncompromising reality of memory care. Individuals with dementia suffer from altered spatial awareness, balance issues, and a total lack of hazard recognition.
Which is terrifying.
It places them at a significantly higher risk for falls and severe injuries. Therefore, how a community manages its safety protocols is the absolute most critical metric of its success.
And the data on Shadow Mountain's safety record is staggering, especially when you look at their state evaluation.
Yes, the state survey.
They recently achieved an official deficiency-free survey from the Arizona Department of Human Services, the DHS.
To understand the weight of that achievement, we really have to look at what a state survey actually entails.
That's not just a quick walkthrough, right?
No, not at all. This is not a casual, scheduled walkthrough by a friendly inspector. These are rigorous, unannounced, exhaustive audits conducted by state regulators.
Unannounced, so they just show up.
They just show up. They descend on the facility and evaluate every conceivable aspect of the operation. They scrutinize hygiene practices, food service temperatures, complex medication management logs, resident satisfaction, and the overall clinical quality of care.
Wow.
So to hit a deficiency-free mark means a facility is not merely meeting the baseline federal and state standards, they are exceeding them across the board with 0 citations.
Which must be so hard to do.
In this industry, that is an incredibly difficult benchmark to reach.
And a major part of how they are maintaining that elite level of safety, specifically when it comes to mitigating falls, is through this really innovative partnership with a technology called Safely You.
Safely You represents a fascinating, highly targeted application of artificial intelligence in a care setting.
Yeah, the AI cameras.
Right. Falls are arguably the most massive logistical and medical issue in memory care. And the way Safely You addresses this is fundamentally different from traditional monitoring or pressure pads on beds.
My immediate thought when I read the phrase AI cameras in the bedroom was massive privacy concerns.
Naturally.
It sounds very intrusive.
Yeah.
But the documentation is very clear about the mechanics of how this works. It is emphatically not a continuous surveillance live stream.
Important distinction.
Yeah. There is no security guard sitting at a desk somewhere watching a live feed of the residents sleeping or changing. It utilizes secure, AI-enabled cameras that are specifically trained to only detect on-the-ground events.
It is purely event-based edge computing.
Edge computing, meaning it happens right there on the device.
Exactly. The camera is constantly analyzing the geometry of the room, but it discards the data instantly unless it detects that a fall has actually occurred.
Okay, that makes sense.
Only then does it save a short, secure video clip of the event, and it immediately sends an alert to the on-site clinical staff.
And that immediate alert drops the staff response time down to under 2 minutes.
Which is incredible.
Contrast that with an industry average that can sometimes stretch up to 40 minutes if a resident falls quietly, doesn't cry out, and, cannot reach a call button.
40 minutes on the floor is devastating.
I was trying to think of how to conceptualize this, and it's basically like a sports instant replay, but deployed for medical safety.
That's a great way to think about it.
In a football game, if a player gets hurt at the bottom of a pileup, The medical team doesn't just guess what happened based on where it hurts.
Right.
They review the tape, they see exactly what angle the ankle rolled at, and they know exactly how to treat it and how to prevent it from happening again.
That analogy translates perfectly to the clinical environment. In memory care, that instant replay capability is revolutionary because a massive percentage of falls for dementia patients are completely unwitnessed.
Nobody sees it happen.
Exactly. The care team enters a room and finds the resident on the floor. But due to their cognitive decline, the resident cannot articulate how or why they fell.
They can't say, I tripped on the rug.
Right. Did they trip on the edge of a rug? Did their blood pressure suddenly drop when they stood up? Were they trying to reach for an object that wasn't there? You just don't know.
The sources share this composite case study about a resident, referred to as Mrs. A, that illustrates this perfectly.
Yes, the Mrs. A case.
She kept having recurrent nighttime falls near her bathroom. If the staff just found her on the floor every time, it would just remain this dangerous mystery.
A total guessing game.
But because the Safely You clinicians could review the short, secure video clip leading up to the fall, they saw exactly what was happening. She was trying to reach for an unstable chair in the dark to balance herself on the way to the bathroom.
It's such a simple thing once you see it.
Exactly. Because they had that actionable data, the staff simply removed the chair, adjusted the nighttime lighting, and installed a grab bar in that exact spot. And she had 0 falls for the next 90 days.
You identify the root cause, and you alter the environment to eliminate the hazard. The clinical outcomes across the board are remarkable.
The numbers are crazy.
Communities deploying this technology are seeing up to 40% fewer falls overall, and crucially, up to 80% fewer fall-related emergency room visits.
Wait, 80% reduction in ER visits? That is massive.
It is genuinely life-changing for the residents.
I can imagine.
An emergency room visit is an incredibly traumatic event for someone with dementia. The harsh fluorescent lights, the chaotic noise, the unfamiliar voices, and just the total disruption of their strict routine.
It must be terrifying.
It often triggers a cascade of severe anxiety, delirium, and sometimes even permanent cognitive decline.
Oh, wow.
So by reviewing the footage and knowing exactly how a fall occurred, the care team can confidently determine if an ER visit is truly medically necessary or if it was a minor slip that can be safely and comfortably managed in-house.
That makes total sense.
It protects the resident from unnecessary trauma while giving caregivers the exact data they need.
So we're looking at a community with state-of-the-art AI fall detection, rigorous deficiency-free safety standards, a sensory-rich Luminate programming model with fresh-baked bread, and live bands playing multiple days a week.
It sounds pretty amazing.
It sounds like an absolute dream scenario for a family in crisis. But anyone listening right now is likely wondering how on earth families navigate the intense financial and emotional complexities of securing this level of care.
Because it sounds expensive.
Exactly. A model this comprehensive cannot be cheap.
The financial burden of long-term memory care is universally one of the most stressful aspects for any family. The industry is often just a labyrinth of convoluted pricing structures, hidden service fees, and really complex contracts.
It's notoriously confusing.
It is. Shadow Mountain, however, has implemented a specific financial and support model explicitly designed to alleviate that friction.
And they start by acknowledging that the family needs care just as much as the resident.
Right.
They don't just hand you a brochure and a bill. They offer complimentary family support coaching sessions.
Which is huge.
They partner with Shannon Ariola, who is a certified dementia and family support coach, and they provide families with a free 1-hour session with her.
That kind of guidance is invaluable.
Her entire role is to help families navigate the tangled emotional, physical, and financial aspects of this transition. Furthermore, they host the First Step support group, which is designed specifically for anyone adjusting to the reality of placing a loved one in care.
It demonstrates a fundamental understanding that memory care is a holistic family transition, not merely a patient transfer.
Well said.
But the most significant operational difference that impacts the family's daily stress is their financial structure. Shadow Mountain utilizes an all-inclusive pricing model, which starts at $7,490 a month.
Now, to understand why an all-inclusive model is such a big deal, you really have to understand the industry norm.
Oh, absolutely.
The standard in senior living is heavily reliant on tiered pricing or base fees plus add-ons.
The dreaded add-ons.
You might see a marketing brochure with an attractively low base rate, but then the monthly bill arrives and it has suddenly spiked.
Yeah.
Your loved one needs help bathing this month. That is an extra fee. They require assistance managing their pills. Extra fee. They need a little extra mobility support to get from their room to the dining hall. Another extra fee.
It basically functions as an a la carte model for fundamental human care, and it creates an immense chronic undercurrent of stress.
Because the needs are always changing.
Dementia is, by definition, a progressive disease. The care needs will inevitably constantly increase over time.
It's kind of like the difference between booking a high-end, all-inclusive resort versus flying on one of those ultra-budget airlines.
Oh, that's a perfect analogy.
With the budget airlines, sure, the initial ticket looks cheap. But once you are in their ecosystem, they nickel and dime you for everything. You pay for your carry-on bag, you pay for your seat assignment, you pay for a bottle of water.
And you just feel stressed the whole flight.
Exactly. When you are dealing with the cognitive decline of your parent or your spouse, the absolute last thing you want is the anxiety of a surprise bill at the end of the month because your dad needed a little extra help tying his shoes.
Right.
At Shadow Mountain, that single predictable rate covers the personalized care, the meals, the laundry, the activities, and the 24/7 staffing.
Everything.
And it covers all of it, even as the residents' care needs naturally increase over time.
There is a massive, often unspoken psychological benefit to this all-inclusive pricing structure.
What's that?
It completely removes the friction between the family and the care staff.
Mm-hmm.
Think about it. In a tiered model, families who are often already stretching their life savings sometimes feel immense pressure to ration care to keep the monthly bill down.
Oh, that is heartbreaking.
It is. They might find themselves trying to negotiate with the clinical director, arguing that their loved one doesn't really need level 3 care yet, even when the staff knows they absolutely do.
That puts the caregivers in a terrible position as well, having to justify their help.
It fundamentally misaligns the incentives. Caregivers inherently want to provide help, but in a tiered system, they have to constantly act as accountants.
Tracking every little thing.
Right, tracking who is paying for what specific service before they provide it. Under an all-inclusive model, the caregivers are liberated to simply provide the exact support the resident needs in that specific moment.
They don't hesitate.
They don't hesitate. They don't worry about what tier the resident belongs to. It allows the entire community to focus solely on dignity and well-being rather than billing codes.
So bringing all of these sources and insights together today, we see a picture that completely shatters the traditional narrative of dementia care.
It really does.
We started by looking at the exhausting 24/7 reality of family caregiving, the heavy burden of guilt, and the grief of watching a partner fade.
The two big G's.
The two big G's. But inside Shadow Mountain, through the integration of invisible AI safety nets, immersive sensory programs like Luminate, and completely transparent financial models, that burden is actually lifted. It allows families to finally transition out of the exhausting role of being full-time stressed-out nurses and gives them the freedom to just be families again, to hold hands, to listen to music, and to share a moment without fear.
You know, it forces a profound shift in perspective. Society has long viewed memory care as a sort of secluded waiting room at the end of life.
A place defined entirely by loss.
Exactly, defined by loss and physical decline. But when you examine a highly engineered, sensory-rich environment where a man who never danced is suddenly moving to live music and residents are laughing while learning Spanish, it completely challenges those assumptions.
It really does.
And honestly, it makes you wonder about the broader applications of these principles.
Where are you going with this?
Well, think about it. If engaging the senses, prioritizing environmental design, and removing the friction of basic needs can so drastically improve the lives of those with severe cognitive decline, what if memory care isn't just a destination for the end of life? What if the architecture of these communities, where safety is seamlessly integrated and sensory joy is prioritized, actually serves as a blueprint for how we should be designing all our cities and neighborhoods to support human cognitive health at every single stage of life?
Oh, wow. A blueprint for how we all should live. I love that.
Yeah.
Think back to that absolute exhaustion we asked you to imagine at the start of this deep dive, and compare it to the image of Pat, simply being a wife again, dancing with her husband and enjoying the music.
It's night and day.
It is. That is the true impact of finding a place that understands the assignment. Thank you so much for joining us as we explored this material today. Keep exploring, keep asking the hard questions, and we will see you on the next deep dive.